Welcome, global health changemakers, to Europe's most influential digital health conference, HIMSS and Health 2.0. You have the power to embrace disruptive innovation, to harness the power of information and technology, to realize the full health potential of every human, everywhere. How will you be the change? Let's reimagine health together as one HIMSS and one world. Together.
Good morning and welcome to the HIMSS and Health 2.0 European Digital Conference and Exhibition. We're so glad you're here and excited to spend the week with members of our global healthcare community to share, discuss and advance digital health forward. My name is Sarah McGeet and I will be your host for today, live from our studio in London. With me is Dr. Charles Alessi, the Chief Clinical Officer at HIMSS. Nice to see you, Charles.
Nice to see you too.
I know we're both looking forward to a week full of ideas, discussions, and people making real change happen.
Hello, Sarah. And hello to all our viewers at home, wherever they are. I'm excited to be part of bringing digital health to life through this virtual conference. It's an interesting and challenging time for healthcare, and I look forward to seeing us connect over the next week.
I wonder, Charles, a question for you. As you look ahead at the week, what's your goal for the conference attendees to take away? Or what is the area you're most interested in learning about?
It's an interesting question you ask, I think, because many of the people who are here today, who are having this conversation, have been actively involved in trying to encourage our peers, health and care systems and payers to incorporate digital transformation in their thinking and strategy, and in the design of new models of care. And what seems to have happened at a speed which is really faster than any of us could ever have predicted is that adoption of telehealth has suddenly been adopted to the extent that in some places, in some jurisdictions, it's now the mainstream modality of communication between the clinician and the patient. And now the big question, of course, is will this persist after this pandemic age? Will it really remain quite as prevalent? And I think only time can tell, but we'll certainly get some insights into this space at this conference.
Absolutely. Thank you very much for that, Charles.
Yes, and this will unfold over the next few days.
Absolutely. But before we go any further, we must say thank you to all of our incredible sponsors for this event, with whom none of this would be possible. We would especially like to thank our Changemaker sponsors, GE Healthcare, IBM, Nuance, Philips, and Roche. And we'll hear more about the exciting work these companies are doing in the coming days. As for our agenda, we have an exciting lineup for you this week. In the mornings, we'll host workshops each with a specialized focus, followed by time to explore our 3D virtual exhibition hall, where over 135 companies from around the globe are represented. The main conference programming will kick off each afternoon at 1 p.m. CET. Today's afternoon sessions all focus on the hot topic of 2020 COVID-19, starting with the keynote, Leveraging Digital Health to Predict, Prevent, and Manage Future Health Crisis. We would like to thank Roche for their support. After the keynote, there will be 3 sessions focused on critical care in critical settings, lessons learned from COVID-19. These will include discussions on making the most of data in times of crisis, how to protect frontline workers, and what we should do to prepare for the future COVID-19 wave. Up next, don't miss Good Morning from Finland, a session co-organized by Health Capital Helsinki and the Finnish Ministry of Economic Affairs and Employment, to wish you a warm welcome to our event and talk about how COVID-19 has changed the health tech landscape and how companies, through innovation, can adjust. Before we join Pia and the other panelists in our studio in Helsinki, we want to thank our Finnish partners for their tireless collaboration, support, and determination in shifting our focus from a face-to-face event to a virtual one. Our Finnish partners include Business Finland, Sitra, the City of Helsinki, Helsinki University Hospital, Kuopio Health, Metsäkeskus, the Ministry of Economic Affairs and Employment of Finland, the Ministry of Social Affairs and Health of Finland, Oulu Health, Turku Health, and the University of Helsinki. We would not be here today without your support. Thank you. And with that, over to you, Helsinki.
Finland is the happiest country in the world, but keeping over 5 million Finns happy is no easy task. That takes creativity, commitment, and lots of skill. This environment has produced over 400 Finnish health technology companies and made Finland a leader in health solutions. Finnish health data is internationally remarkable for its high quality, breadth, and variety. The data is highly unique and easily recombined for new purposes. Finnish innovation is driven by our free and effective education system that ranks at the top of the world. Finnish research in oncology, immunology, and vaccine development is highly regarded. The quality of personal care is guaranteed by excellent training and cutting-edge technology. Thanks to technological education and research, as well as Nokia's legacy, Finland has managed to build a strong position in the fields of artificial intelligence, 5G, and virtual reality. Finland offers an easy, open environment for starting new partnerships. We have a wide network of startups that invites you to join in and innovate. Health Capital Helsinki will be your guide. We develop networks and bring together different players.
Hello everyone, and good morning from Finland, or evening or afternoon, obviously depending on where you're located. On my behalf, I'd like to warmly welcome you all to HIMSS Health 2.0 European Digital Conference. This autumn, for the reasons we're all too familiar with, we get to enjoy the digital version of the European Conference, which, on the other hand, opens many positive angles and opportunities. For example, I had the chance to welcome you all to this Good Morning from Finland session from the beautiful Hanasaari venue we are currently in. My name is Nelly Soger, and it is my absolute honor to serve as your host in today's session. I'm an engineer by background and have co-founded 2 health tech startups, the latter of which, called Fifth Corner Inc., was acquired last fall by HIMSS Performance. So this ecosystem, the problems this ecosystem is solving, and the topics we're going to discuss today are very close to my heart. In this session, I will host a panel discussion with 5 healthcare and health tech professionals on a very interesting topic that touches us all. But before that, and to get the day started, it is my great pleasure to invite on stage the wonderful Pia Heikkorinen. Pia works at Sitra, the Finnish Innovation Fund, as a theme expert on the capacity of renewal. She's also a Secretary General for Finland at HIMSS and Health 2.0 European Conference. So welcome, Pia.
Thank you very much, Nelly. Pleasure to be here.
So, Pia, you were part of the last year's HIMSS Health 2.0 European Health Conference team. The conference was chosen as best of all exhibitions, congresses, and events held in Finland in 2019. I mean, that's amazing. What was the trick, and what was your secret sauce, if you could share that with us, please?
Yes, of course. Indeed, we were chosen the event of the year last year, and it was our first collaboration with HIMSS. And then I could say that there were 3 key elements that were contributing to this great success. First of all, obviously, Finland is very well known for its excellence in expos and unconventional conventions. So we were really able to utilize the absolute best facilities in the world, and also to fuse operations and content on a very optimal way. Second of all, we had the great combination of experts and funding partners in Finland, and they comprised of the whole nation of Finland and its ecosystems. And this exceptional collaboration was a key to the success as well. And thirdly, I would like to mention, of course, HIMSS and Health 2.0. They have been very progressive and very bold. And these are the exceptional times that have really required bold actions. And because of the great partnership with HIMSS and Health 2.0 and the Finnish national effort, we have been able to make this success happen. And with this, I would like to take on with us London, because in the London studio, we have the 2 great distinguished men. We have Mr. Bruce Steinberg, and we have Mr. Charles Alesi. So, London, would you please like to join us? I can see you. Hopefully, you will let us know that you can also hear us.
Yes, yeah, absolutely. We can hear you.
Okay, fantastic. So I know that this community and all the HIMSS communities know you very well. But since we have a great variety of different kinds of people looking at this session, I think a short introduction would be in place. So we have Bruce Steinberg, who is the Executive Vice President of HIMSS International. and he has a very diverse and long background in also disruptive technologies. So Bruce, would you mind introducing yourself to those who doesn't know you previously?
Fantastic. Thank you very much, and thank you for having us. And Pia, lovely to see you all the way in Finland. Hi, my name is Bruce Steinberg. I'm Executive Vice President of HIMSS International, and we're delighted to have all of you join us at the HIMSS and Health 2.0 European Conference 2020. Pia, maybe I should talk a bit about what HIMSS is. As you said, many people don't really know about us around the world, although we're making tremendous progress. HIMSS is a global nonprofit. Our headquarters are in Chicago. We have offices around the world, from London to Harrogate to Berlin, Barcelona, Leipzig, and Singapore. And our vision is to realize the full health potential of every human everywhere. The mission and the way we do that is to help reform healthcare globally through the power of both information and technology. So our activities are incredibly diverse, and the key word that unifies all of it together is thought leadership. Around the world, we promote the global sharing of innovative technologies and approaches and best practices in healthcare. Well, most importantly, we do this through our membership and our communities. We have over 100,000 members around the globe who are HIMSS members. We do it through our conferences, like our flagship European conference this week and next year in Helsinki. We do it through our global media properties. Healthcare IT News is a global property, but we have local versions in Europe, the Middle East, Japan, Thailand, and Germany. And importantly, HIMSS Analytics, our team uses our 7 global maturity models, like NRAM you may have heard of, or CCMM, to help guide the digital maturity of hospitals and health systems so they can achieve better outcomes, including saving lives and reducing the cost of delivery. Charles?
Well, and of course, I'm the Chief Clinical Officer of this organization, and I reckon I have the best job in the world.
Absolutely.
You know, I became a physician really to try to fulfill the vision of HIMSS, which is really to realize the full health potential of a human, and which is really what our vision is. And suddenly I have a platform whereby I can do that globally. Wow, what an opportunity. And what an opportunity we have together.
Thank you very much, gentlemen. And I would like to add on to this conversation is that we definitely share your mission of better health through information and technology here in Finland. And you have made a quite bold move, actually, to move the European conference to Helsinki. So can you explain to us and our audience what were the main reasons for you to choose Finland as your partners?
Sure. Thank you. Well, besides the great people and the weather, and of course the award-winning gins, Finland is an amazing pioneer on many fronts of health and care innovation, and we realized that it wasn't really well known. So we wanted to highlight this incredible thought leadership to our members globally, with topics such as cross-border interoperability, which you've done with Estonia, your amazing world-leading secondary use of data. Many people, I understand, are now interrogating that data in Finland, the integration of health and social care, et cetera. So finally, one of the reasons we moved is we have 11 amazing Finnish partners that have provided an incredible amount of support. And I would like to thank all of our partners for all your help. We really appreciate it. Charles?
Finland is the obvious place for me. And it's the obvious place for a few reasons, but mainly because it's my pocket time machine. I call it my pocket time machine because if I want to see where health and care is moving globally, wow, I can just look at Finland because you have the thoughts and more importantly, you implement stuff we talk about before we finish talking about it. And that is an incredible opportunity to see how you're doing it and try to adapt that approach to all the different jurisdictions in the world.
Absolutely.
Thank you for these kind words. Finns are not very used to brag about themselves. We are very modest people, but I can verify that everything you have said is actually true. So also, Charles, you are the chief clinical officer, but we know you as a very enthusiastic advocate for primary care. Can you explain to us how did you end up working for a global organization like HIMSS, since you're a primary physician yourself?
Yeah, my whole life, Pia, has been a series of accidents. And it's quite interesting when I talk to medical students, which I sometimes do in terms of, career progression. And they always ask me, oh, you do a really interesting job. All the things you've done in your life. So could you describe how I can do that as well? And I say, well, sorry, it didn't work like that. It's a series of events, and you end up in a situation where you somehow end up in a job whereby you can influence an enormous amount of people. And that's really where we ended up. I think it's really by being passionate about what you care about. And clearly we have something we all feel passionate about, and that's the potential to really influence how people are living their lives. And I think this is one of the most wonderful opportunities we have to do that. And we must make sure we take every advantage of it, which is exactly what we're doing.
We should, absolutely.
Thanks. That's exactly, we agree, as you said. But Mr. Bruce, can you tell us, because both of you have a very good knowledge of the situation with the COVID around the globe. So can you let us know what are the positive aspects, since we are the happiest people on the planet? We would like to know what are the good things coming out of the COVID. So from both of you gentlemen, can you please share us your views on this?
Yeah.
You or me?
So I'll start. So one of the best things is the openness and the acceptance of remote healthcare, especially things like telehealth, and we've seen that around the world, where there was a bit of hesitation amongst many people, health systems, clinicians, et cetera. Now I think they realize the full potential of the ability to manage remotely, and remote visits, video visits, Skype visits by clinicians around the world are really, really climbing tremendously. And we hope that post-COVID, which there will be a post-COVID, that this will continue and that remote monitoring will be a way of a norm, really. Charles?
It's very difficult to think about something positive around a pandemic, which basically has caught health and care systems around the world by surprise, because it's outpaced their ability to actually manage to counteract its effects. But I think if there's one, it's the fact that this pandemic has demonstrated that it's impossible to manage a process unless you have interconnections between the different actors that are associated with assisting a population in doing that. And it's impossible to do that in the old analog bricks and mortar way. You just can't do it, because you need to have your medical record, your health record, your data, everything needs to be there immediately now in a granular form. And so in many respects, it's acted as the supercharger to the thoughts and to the processes we were involved with over the last few years.
Works as a catalyst, and me coming from the organization that looks into the future, sometimes we need these kind of disruptions to just make us act sooner rather than later. And so we are hopeful that a lot of good things come out.
You're absolutely correct, Pia. Never lose the opportunity of a good crisis. And wow, have we had a good crisis.
So we have a few more seconds. So what would be your tips for people who are watching this great week? What's in the program that's really hot right now?
Well, the content, Pia, really aims to cover the most important topics for every delegate and to be inclusive, because HIMSS is very much an inclusive organization. So the list is quite long. I'm just going to tell you what I'm going to make sure I see. Of course, Good Morning from Finland, both episodes with my Finnish translator. And all the keynotes, we have keynotes starting at 1300 CET and then at the end of the day. So all the keynotes will be really interesting. I think the sessions on COVID, as we talked about, and innovative technologies, Nordic health, we have a couple of sessions on that, precision health, and something near and dear to me, the silver health economy. Charles, what are you interested in?
Well, I mean, I think the people who are going to attend and the people who are listening to this today are in a really privileged position because they've been given the key to the magic sweet shop. And it's the sweet shop where all the sweets in the world are actually on the wall. And the question is, which one do you want to try first? Because they're all there. If you want to know about the silver economy, oh, I'll have a look at that. If you want to hear about how telehealth is influencing the care of, oh, you pick that one up. It's a wonderful opportunity, a wonderful library. You've been given the encyclopedia of the world and access to it. And I really think you should take it because that's the only way we learn, by sharing and by learning how others have advanced and by areas where perhaps we haven't advanced as well.
Well, thank you very much, sirs. This was a great pleasure to start this week with you. And unfortunately, our time is up right now. So I want to thank you from the bottom of our heart. And thank you for participating and sharing your views. And this is all for me right now. So thank you and enjoy the rest of the week.
All right, ladies and gentlemen, at this point, I'd like to remind you to use the hashtag HIMSS Europe 20, hashtag BA Changemaker, and hashtag Good Morning from Finland to spread the best learnings and insights of this session. All right, thank you so much, Pia, Bruce, and Charles for the uplifting opening of the seminar and this general session. And I have to say, and also speaking from my personal experience as an entrepreneur, that HIMSS and Health 2.0 are truly a low threshold platform for anyone who wishes to gain some inspiration or get some investments or partners or ideas how to internationalize their projects or businesses. So please do take advantage and fully enjoy this opportunity and this conference. But next up, we're going to deep dive into a panel discussion about a topic that touches all of us here: COVID-19 and its impact to our health tech scene. What has changed and how much? And is the change the health tech ecosystem is experiencing of permanent nature? I have to say, I couldn't be more excited about the professionals I'm going to have this conversation with. First, I'll introduce Mr. Lasse Rousi. Lasse Rousi is the CEO of Medixine, a Finnish growth company specialized in connected care. Medixine Solution is a unique connected care platform offering all the tools needed in telehealth with a signed population of over 2.5 million end users. Lasse has been working in digital healthcare for over 10 years, both in startup and in corporate worlds. He works passionately in a business that aims to improve the quality of life for all of us and combines his personal interest in healthy life and sports. Lasse holds a Master of Science in Technology from Tampere University of Technology. So welcome, Lasse.
Thank you, Nelly. Very nice to be here.
And next up, I will invite on stage Dr. Asta Raami. Astaramin is an intuition researcher, educator, and author. She defended her PhD thesis on the development of intuition in creative processes in 2015 at Aalto University Media Lab, Finland. Asta has worked 15 years altogether in the academic field in various teaching and R&D positions. She has written several books on the use of intuition as a factor in expertise and the general skills of work life, as well as on harnessing the potential of intuition in visionary and radical innovations. In Finland, intuitive information is acknowledged in the national curriculum. And in relation to this, Asta educate principals and teaching staff in integrating intuition in pedagogy at the University of Helsinki. So warm welcome, Astaramin.
Thank you, Nelly. Awesome to be here with you all.
And next up, we have Mr. Pekka Rissanen. Pekka Rissanen is the co-founder and CEO of Deep Sensing Algorithms. In his role, he aims to accelerate the COVID detection company into the global markets. Pekka has previously worked as a senior vice president at Teleste Corporation and participated the company IPO. He has since been a serial entrepreneur, angel investor, and board member at several startup companies. Pekka holds Master of Science in Technology from Tampere University of Technology and MBA from Murray State University. So welcome, Pekka.
Good morning. And I would say that Finland is supposed to be the happiest country in the world. So I'm very happy to be here, Nelly. Thank you.
That's great. Thank you. And next up, we have Mr. Erno Morando. Erno Morando is the Managing Director of GE Healthcare Finland and the Engineering Director of GE Healthcare's Global Mobile Digital Health Program. Erno's responsibilities include driving the growth and development of GE Healthcare Finland and its 700 employees, as well as GE Healthcare's collaboration with key clinical, university, government, and corporate partners in Finland. In addition to being actively involved in developing GE Healthcare's startup ecosystem called Health Innovation Village, and also leads GE Healthcare's global engineering organization that develops wearable patient monitoring technology and products. A 20-year GE veteran, Erno holds a master's degree in engineering physics from the Helsinki University of Technology. Welcome, Erno.
Thank you, Nelly. Glad to be here on this beautiful autumn morning.
Great. And last, but definitely not least, Dr. Leena Niemistö. Leena Niemistö is a healthcare professional with 30 years of clinical and leadership experience. Leena worked as a CEO in a private healthcare company, Dextra, from 2003 until 2016, and a deputy CEO in a social and healthcare company, Pihlajalinna, from 2013 until 2016. Currently, Leena is an active investor in several health tech growth companies and co-investing with European Angel Fund Finland. Leena is also a board member in several publicly listed companies, startups, organizations, and foundations. Leena holds MD and PhD from Helsinki University and Doctor of Administrative Sciences honoris causa from Vaasa University. So healthcare professional with many hats. Welcome, Leena.
Thank you, Nelly. It's so nice to be here today in this beautiful morning and set up.
Exactly. Wow, what a group of professionals. Thanks everybody for being here. Before we get the conversation started, I'd like to warmly thank our sponsors and enablers of this session. So Health Capital Helsinki and the Finnish Ministry of Economic Affairs and Employment. Thank you very much. Oh, and one more thing. Please remember to ask some questions if you have any via the Q&A box you have on the right side of your screen. But now let's get started. You ready? Nice. So, COVID-19 came and changed many things in many ways. Healthcare and health tech were no exceptions. In a few sentences to get the conversation started, what were the biggest things that were forced to change in your business or in businesses or areas you are working with? And Pekka, could you please start?
Yeah, Nelly, I think that the situation with our company is a little bit different than with the many others because our whole business concept was created because of COVID. We are developing a new technology for the detection of COVID virus from the exhaled breath. So in a sense, it's difficult to compare to anything in the past because as the company was founded this year, we have no past.
Wow, thank you. How about Asta?
I think this it became visible that reasoning is not always enough. We need more radical innovations. And what became visible was that we have this primitive side of us, which fears, and we have also emotions, and we can't ignore them. Rather, they become very visible. You know, people are taking toilet papers and have these primitive urges and drives, and they became very visible.
True, that's true. How about Lasse?
Well, we with Medixine have been in the field for almost 20 years now, but have found ourselves in a position now where we have been able to help to cope with the current situation. So this year really has been about growth for us, about expansion.
All right. Thank you. So how about Erno?
Well, we're hearing many stories about companies needing to invent something new because their existing business models go away. We were in a completely different position. At GE Healthcare Finland, we design and manufacture patient monitors and gas measurement units for ventilators for ICU. So we had actually exactly what was needed for the healthcare system. Our big challenge came, how do we manufacture them more, much more? I mean, we saw hundreds of % of increase in order backlogs in just few weeks. So that was our challenge.
Well, that's a positive problem. So how about Leena?
Well, as I work with a lot of healthy companies, all of them are in the little bit different phases and situations. But I think the common issues are the agility to react to the new situation and to the new normal. Everybody has to think what is the best business model and the best organizational setup for today and also for the future. Sales contacts have changed, so everybody had to build their sales processes on the new setup on webinars that are educational and relevant for the customers, but also building for the future. So focus, for instance, for the future clinical trials, for the widen the distributor network, maybe deepening your strategic partnerships for the future. Wow. So many things.
So many things. Thank you so much. So, wow, so many angles we could take now. But I suggest we first take a satellite view. How has this wave of changes affected the health tech startup scene? And to get started, Lasse, could you please open your thinking about that?
Well, I think we really have seen how the pandemic has acted as a catalyst in proving the benefits that the digital solutions, the digital startups can bring. We were expecting for the main street adaptation of these services to take from 1 to 2 years. It took from 1 to 2 months, actually even 1 to 2 weeks. When the medical professionals really were forced to look at something new, at the new ways of working, they were no longer able to meet the patients face to face. And they turned to these solutions, these startup solutions, connected care especially. And this has proven the value. And now we can see huge interest in the field. We have many interesting players. And the future really is looking bright at the moment.
Wow. Pekka, did you have any further comments on the...
Well, I think that COVID developed some opportunities, and that's what I think we both have been doing. I actually wanted to continue a little bit what Asta said earlier about the fear what we have, because COVID is inside our heads today. And that is something that we have to conquer. We have to conquer the fear. We can't be afraid of the fellow man. We can't be afraid of our neighbors, our friends, our family, and our co-workers. And that is only the start when we can start to innovate more. The startup scene, which is there, you have to believe in what you do. And for being able to do that, we have to rely on the fact that there's going to be future for this world. And we have to trust that things are developing for the better. That's when you get your attitude going.
Exactly. Asta, please.
And what actually happens in the human mind when you fear, you start to narrow your thinking. You go into freeze, flee, or fight mode, and creativity shrinks. Instead, you should create an atmosphere of trust and support, so you get more creativity then. We have an enormous human potential, and often we just look at the technological development and ignore the human mind. But you know, the human mind is a brilliant outcome of development of how many billion years? And we could benefit it. It has such a potential that it's still unused.
Really, really good point. And our health tech startups consist of humans and obviously who develop technology. So really relevant points. But how about Leena? As an early stage startup investor, what kinds of changes have you witnessed in the investment scene, for example, for health tech startups?
Yeah. First of all, I've seen more collaboration between different startups, and I think that is really, really welcome. Wow. That is a good thing. But as for the investor perspective, well, I think the whole health tech sector is even more relevant today than before. And there's a lot of increasing interest from the investor side. There are even plans in the Nordic level building separate life science funds. So really, really interesting. But as for the acute situation, there has been a lot of bridging rounds, of course. And what I've noticed that all the funding around the processes has lengthened a lot. So a lot of challenges, but I would say that the good ones survive definitely, and there's always funding for the good innovations.
Thank you, Leena. Really good insights. And how about Erno?
Well, coming from a huge corporation, I'm always amazed the speed how startups can react and move the direction. We host a startup campus, like you mentioned in the introduction, of 40 startups in our site where our factory is in Helsinki. And there I have witnessed a couple very interesting examples. Company called Body Healthcare, they make an application at normal times for patients to prepare to come in surgery. So the app asks them that have they stopped eating and so forth. And if they don't respond, caregivers can communicate and ask, hey, what's going on? Well, surgeries, of course, went down when COVID started, but they very rapidly tuned their application to actually help the communication between the hospitals and the patients on COVID symptoms to see that, okay, is your symptoms getting above threshold that you should come to a hospital and so forth. So very quickly adapting there. Then another example, a company called Rehabo, which makes a kind of gamifies exercises during your office days. We have it on our office, 3 of these game stations where you move your whole body and that way steer a guy going to an obstacle course. So you can get a 5-minute break and get some exercise during your office day. Well, nobody's in the office. But that company very rapidly started then to develop a laptop application. Much harder because you don't know what kind of cameras and computers are, but they went that, okay, we need to reach the people at their home office and provide them also exercise breaks and help that way to help. Very impressive how quickly they reacted.
Wow, wonderful examples. But at this point, question to our startup gentlemen, Pekka and Lasse. So did I understand correctly that in your cases, COVID has created new businesses or completely new lines of businesses or a pivot of some sort? If you could please elaborate a bit more on this change. And Pekka, could you please
Sure, Nelly.
start?
We actually established this company this year for the sole purpose of detecting COVID. I mean, we had a clear game plan how to go into cancer research. We were going to do early detection of lung cancer as our first application. Then comes COVID, and what is it? Is it a global problem, or is it an enabler of our business? We decided that it becomes an enabler, and we went all in 100% into the detection of COVID with new technology, and we're in the final stretch of that.
Wow. How about Lasse?
Well, as a company, we were in a lucky situation that our offering was a kind of a perfect fit for this situation. But still, I saw that everything happening kind of in three phases. First, at the beginning of this year was the shock effect when the COVID hit, and that was also a survival mode for us. Nobody knew what would happen. But soon after, the benefits that solutions like ours could bring became evident. And then our focus was clearly supporting the treatment of the COVID patients. We had a COVID-specific solution of our platform, and also new ways of using the solution for the easy patient meetings. And now I kind of feel that we are in the third stage, where we are, well, not over the pandemic, but maybe used to it, and looking more forward, looking at not only COVID-specific solutions, but bringing these same kind of ideas and possibilities to general use, to other pandemics, even treating the normal influenza. So now more looking forward and widening the use of these telehealth solutions.
Wow, that's happy to hear that. But how about Erno and Healthcare Finland? So not necessarily completely new offering or a pivot, but pretty impressive growth due to increased demand. So could you please elaborate a bit more on that?
Yes. So for us, the scaling up was a massive challenge. Typically, industries, if they have so-called double-digit growth, we're happy. But if it's several hundred %, that actually creates a lot of challenges. Manufacturing infrastructure, how do you build product lines? Where do you get people? We needed almost to triple our staff at that factory, move from 1 shift to 3 shifts and weekends. At the same time, the COVID was on. It was at the worst moment in April, May. How do you keep people safe? How do you build all the arrangements to keep distancing, disinfection, so forth? And even then many very practical problems. We needed to set up take part of the employee parking as warehouses. But at the same time, there were so many people coming in that we needed to create special arrangement for steering traffic and all that. So perhaps the most interesting, exciting time of my career of living with this.
Wow. Thank you for sharing. That's quite a story you have. But now I suggest we shift to being innovative and creating innovation. So as discussed, COVID has pushed many of us to be innovative after the first shock had sort of melted away. But Asta, I'd be curious to hear what you have learned in your research about being innovative in this kind of a pressure cooker situation that the COVID has created globally.
Yeah, if you have a lot of stress, you may find really good solutions to get out of the stress. For example, in accidents or in panic situations. But if you ponder creativity, that's not the situation where you can expand your thinking and innovate with radical outcomes. So what the human brain needs is play, safe environment, feeling of being accepted, cooperation. We need better thinking. And now when we are not anymore in this crisis mode, we could invest in better thinking. We could invest to those areas where the radical innovations come. And very seldom they come from big companies. Often they come from garage, Facebook, Apple, Google. And that's why I think Finland is very pioneering country. since we support education and we support thinking and develop also these skills in children, because those are the ones who will solve the problems we have created.
Exactly. And as you said, there are many ways to sort of lay the groundwork for innovation in a situation that is a bit less of a pressure cooker. But can we talk a little bit more of that? Like, how can, companies, that are small or large, somehow induce innovation and make it easier? So Asta,
we need to expand the solution space, because otherwise we may end up fixing the wrong problem with inefficient solution. So often we don't look deep enough to find what is the root cause of the problem and how we can then support these radical innovations.
Wow. But questions to the whole panel. In your opinion, what kinds of structures in Finland support the creation and development of innovations? Or if you have any stories to share, Erno, maybe you could start with some. I know you might have an interesting view.
Absolutely.
Share.
I would say that Finland is a very much trust-based society, and that trust creates us some benefits. So, especially when we talk about healthcare technology, there is the healthcare and there is the technology part. Engineers may not really understand what is needed at hospitals, and doctors may not always imagine what technology could do. So how do you bring these two together? That's especially easy in Finland because there is a lot of collaboration and trust. These kind of little seeds of collaboration don't die in massive bureaucracy. And we have had several examples of innovations that have started with just one engineer and one doctor thinking, hey, could there be a solution for this problem? And there it goes.
Wow, that's great. And how about Asta?
Yeah, I love Finland because we are so rational. But sometimes the experts are having really good information and excellent knowledge and beautiful models. But since the world and viruses are unpredictable, so sometimes the expertise may also limit you to see the new solutions. And how to balance between these, that how to use the expertise, but yet to be open enough to see those radical innovations, which you may often ignore because they seem not possible, or this is not valid, or this is not accurate, or whatever. But instead of just supporting technology and investment on technological innovations, you should support also this thinking that it's the humans who are exceeding the known and inventing these solutions, even though they are technological innovations. But we need human brain. That's a brilliant, elegant system.
Wow, that's so true. And first, take Pekka.
Yeah, I come from outside of the industry, and when I compare to telecom or ICT, where I come from, I'm a strong believer in an ecosystem, and there we had a very, very functioning ecosystem. We had large companies that worked as engines. We had the Finnish government stepping in nicely. We have public companies providing funding. Any company who you establish can easily find clients and customers and serve them. When I entered the medical field, I was not sure if the same ecosystem exists, but amazingly, I have found that it's here. There is an opportunity, at least now when COVID changed the thinking a little bit. There is the same kind of ecosystem. There is the government who is stepping in with nice kind of support. There are larger companies coming in as customers and clients. There are research institutions who have their doors open for small startup companies to come in, and there seems to be even willingness to fund these applications. So I'm a believer that this is a great place of doing business.
Exactly. How about Lasse?
Yeah, well, actually, I do completely agree with you and everybody else here that Finland is a great place for this. And as you said, cooperation hubs business hubs, networks, they are really crucial for this, like Helsinki Health Capital, for example, bringing together us, the small startups, then the corporations like Erno here, and then the public sector, where even the big hospitals as Helsinki University Hospital is supporting the work by startups. And this brings the views from many different sectors together, and through that we can find the great innovations.
That's true. How about Leena?
Oh yeah, it's really easy to concur with all of you. So I think we have a great technology knowledge, but also our healthcare system is on very high level. So just to mix those two capabilities, that has to be. There has to be some perfect out of that, but also as we are really a small country, it's very easy to take contact to different specialities and right people. So we have a lot of benefits, yeah, and I think we're quite humble. And we have a right mindset for innovating.
Very true. So Asta, please.
Humbleness is actually very important from intuition side, because then you can open yourself up to the greater knowledge and information. You're not just working from your own expertise, but you listen to others. You recognize new signals in the constantly changing environment. You're not dependent on your primitive urges so much.
Very much true. So looking forward, how does your business and innovation journey continue, and what has changed forever for you due to COVID-19? And is the digital leap actually really happening? So actually, Pekka, would you like to start?
Well, we definitely hope it's happening and happening, because we are fully in digital. Our thinking roadmap includes ideas that we will be able to deliver more algorithms where more medical conditions from different people all around the world can be detected with non-invasive technologies. We foresee that when you go to a doctor's office 2 years down the road, that visit is going to be completely different than what you do today. And that is due to the digital technology and new technology that will be available.
Exactly. How about Asta?
Say that we are having a human mind leap. That can be integrated with digital technology. But first we need to support our human system.
Very true. How about Lasse?
I'm looking at this in a more practical view, but yes, I really see the leap happening. It has happened and proven the benefits. Actually, we just had our daughter's first dental visit. She's 1 year old, and usually the visit would be a mixture of timing, lunch, nap time, work, and everything. But now we did it with a web conference from our home, taking 5 minutes. So it's in practical level, the benefits we can now bring, it's so evident and clear that I'm confident that this is to stay.
Wow. How about Erno? What's next?
Well, maybe for G Healthcare, the big realization has been the healthcare's need for flexibility, scalability, because often it is planned. You have certain very specific training to areas. But when this kind of pandemic situation comes, you need to get much more nurses, doctors, for example, to intensive care. You don't have time to train them. So how can technology bridge the gap? You see that the infection hasn't treated all the regions the same. So you might have capacity somewhere where capacity somewhere else is completely exhausted. So digital can very rapidly kind of manage that allocation of resources. And on the other hand, when you take a nurse from another specialization and bring them to the intensive care, technologies like artificial intelligence can help them to bridge the gap between their trainings. And also the ease of use, how easy the complex specialized medical equipment is to use. The easier it is to take nurse from another specialization to intensive care.
Exactly. Thank you, Erno. How about Leena? What's next on your innovation journey and what you're expecting?
Well, I think what has happened, it's about a leap in the mindset, as Asta told us, but also concrete things. I think it's about, as it comes to the healthcare services, it's about omni-channel. So we have talked long about omnichannel regarding retail, but now I think it has come to the healthcare sector. So you have to just be as relevant virtually as in physical meetings. And after all, I think it's all about human to human, whether you are in the B2B or B2C sector. So just that all your human to human contacts has to be relevant, and all the other things can be automated. So there will be intelligent chatbots, there will be intelligent automation of the processes will be automated, and also I think there will be a change in the sales contacts. So there will be at least partly done virtually. But anyway, there still is a place for physical face-to-face meetings, of course.
Wow, thank you so much, Leena, and all the panelists. I think we have a few minutes to take some audience questions. And the first one is, what has the COVID-19 done to international activities and partnerships? Have they increased or decreased? Who'd like to take? Please, Lasse.
Well, I can start. We are a small Finnish startup, but still 70% of our revenue at the moment is coming outside of Finland at the moment. And I'm really happy to see that the countries looking for solutions for this current pandemic have not only looked inside the countries, but looked at whole of the Europe, actually whole of the globe. And we have seen many challenges and competitions for startups trying to find a good solution for a specific problem here, and they've all been open for everyone around the globe. So very happy about this. It's a huge increase.
Wow. How about Pekka?
Absolutely increased. I mean, think about it. We have 2 very international business partners, sales available to 50 countries. We have research hospitals from more than 10 countries involved. Our biggest investor is from Los Angeles, and our company is less than 100 days old. It would not have been possible last year.
That is very, very true. So, Erno.
I think this is very, very important questions, because the technology, healthcare technology is not an exception, is complex web, global web. And we saw, unfortunately, in this pandemic, we saw quite many situations where governments of countries thought that they can secure, by using the internal closing borders, secure some of their production inside the country for their needs. Well, unfortunately, you cannot produce anything complex in today's world without parts coming from many places. So to me, one of the lessons from this also has to go to politicians, government officials, to think how to secure the global collaboration and opening, keeping the borders open, because only that way we can secure manufacturing of complex medical technology or other technology that is needed in times of crisis.
Wow, so true. So, do you have any more comments on this?
Just one more comment. As it comes to health tech sector and health tech scene, I think it's always global and international. So if you are just domestic player, you don't have, sorry, much to grow. So definitely my experience and that it has grown. Yeah.
Great. So I think it is time for us to wrap up, and I hope all of you have enjoyed this lively discussion. We're grateful we got to spend this moment with all of you. So I suggest we continue this conversation during and after the conference and on social media. We obviously hope to see as many of you as possible in Finland next June at this very conference. Fingers crossed, we can enjoy the HIMSS Health 2.0 European Conference in a live physical event format in Helsinki. On my behalf, I'd like to wish to all of you best of luck to overcome this challenging episode. And on a positive note, I hope as many of you as possible can leverage this global COVID change engine to jumpstart new innovations and chapters. Once again, warm thanks to our wonderful panelists, our sponsors, Health Capital Helsinki and the Finnish Ministry of Economic Affairs and Employment, and of course, thanks to all of you listening to our conversation online. And you are more than welcome to visit our Finnish partners' exhibition booths or digital stands or digital booths or whatever they're called now these days. And you can find the link on the right-hand side of your screen. And now I really encourage everyone to enjoy HIMSS Health 2.0 to the max. So thank you, take care, and bye-bye.
Welcome back to the studio in London. What a fantastic way to start out our conference in Helsinki with our Finnish partners. As you can tell, we have an exciting week ahead. Up next, we have an interactive forum, Patients 2.0, where we'll discuss how to build a system which equally cares for the mental health as well as the physical needs of patients. We'll address specific challenges and have a live showcase of innovative digital therapeutic solutions. No doubt a session which you will not want to miss. But before this session begins, and since we are all new to this platform, we're going to bring you over to the help desk, where you can watch a short 3-minute tutorial on how to navigate around our environment. Take a few minutes to watch this video and then wander around yourself to see all the exciting opportunities and interactions we have in store for you this week. We'll see you back in the auditorium at 9:45 a.m. Thank you and see you soon.